When we come to possible side effects of the drugs, I will go through it with you in detail, and we will also give you a hard copy of this information. It is important to note that most of the drugs we use for treatment in these conditions are not licensed for use in pregnancy, but there are very few medications that are licensed to use in pregnancy. The commonest drug that we tend to use if there is an immune problem is prednisolone. And prednisolone is a steroid. And normally it's given in a tablet form. You take that in the morning after breakfast. Because prednisolone is harsh on the stomach, I normally like to combine that with an antacid such as ranitidine or omeprazole, taking that medication before breakfast. One of the side effects of prednisolone is difficulty sleeping at night because it gives you a buzz of energy, or waking up early or having vivid dreams. Other side effects include mood swings, feeling hot, feeling cold, palpitations, dry mouth, putting on weight, especially if you don't watch what you eat. But in general, most patients tolerate the medication reasonably well. With regard to the baby, most of the prednisolone gets broken down before it reaches the baby, and because of that, there is not much known side effects on the baby. You may come across that it may increase the risk of cleft lip in the baby. However, that has not been found with prednisolone in humans due to the fact that there is an enzyme in the human body that breaks it down before it reaches the baby. Another drug we tend to use is Cyclogest pessaries. And Cyclogest is a progesterone, and that is given either through the vagina or through the rectal passage. And the main benefit of Cyclogest is to give you hormonal support, but it has also been shown to reduce the risk of preterm birth, second trimester losses, and possibly also first trimester loss. The side effect of progesterone is mainly bowel issues such as constipation or diarrhea. Otherwise, it is quite well tolerated. Another drug we use is aspirin, 75 milligrams. And I like to give my patients aspirin pre-conception, although I do know that some authorities believe giving aspirin only at positive pregnancy test. However, in our experience, that taking aspirin at least 6 to 8 weeks before conception reduce the risk of miscarriage. Most of our patients will continue on the aspirin up to 20 weeks, and the drug is very well tolerated, unless, of course, there is a contraindication for you to take aspirin due to, for example, a stomach ulcer or having side effects with the medication. Other medications will include things like intralipid infusion or intravenous immunoglobulin or hydroxychloroquine. And these drugs are not as commonly used, for example, as prednisolone or Cyclogest. As every other drug, there are associated side effects, but our experience that these drugs are reasonably well tolerated. It is important to note that most of these drugs are not licensed for use in pregnancy, and that we also lack scientific evidence to tell us that these drugs would work in your condition. However, we're using our expertise and other authorities in the field and designing programs that we feel are appropriate for your condition. But don't worry, this is just information to give you beforehand. We will go through the treatment program in detail and answer all your questions. And obviously we'll give you time to digest all that information and even come back and ask us further questions if you wish to do so.